Hi, we're going to show you how to set up a cell saver in case you have to emergently collect blood. If perfusion is not here, then the nurses can set up the cell saver to collect blood. So the cell saver lives in the pump room. The supplies are also in that room. They should be found on the cart. The first thing you want to do is grab a bottle of normal saline, 1,000 milliliters, and 30,000 units of heparin. If the machine is in use, you can go to the pump room and also grab this IV pole. It comes with a canister or reservoir, and also the suction tubing that goes to the sterile field, and a regular suction tubing. And you can start to collect the blood on here, okay? So when you get to your setup, you'll take your reservoir bag and open that, the circulator wheel. Inside, you'll find the reservoir and you'll find a pigtail. It's important to take the pigtail and connect it first so that you don't have a reservoir full of blood and then you're trying to connect it later. And you'll want to take this slide clamp and go ahead and close that. The reservoir connects to the side of the machine. It has a little bump there, fits in the wedge, and locks into place, okay? You'll also take a non-sterile suction tubing, use your yellow cap, connect to the back, and connect this to your suction tubing, or your suction machine, okay? On the sterile field, you'll have a tubing. The scrub will keep the end that's a single. This goes to the field to suction. You can put a suction tip on it to remind yourself. The other end is handed off to the circulator, and that end has, I can do this, has the blood collection tubing, and also a spike for your IV solution. You'll want to go ahead and take one of these blue caps off, it doesn't matter which one, and this way you can actually put two tubings into the same canister at the same time if you're losing that much blood. Go ahead and attach that and close the other ports. That gives you a good suction inside. You'll go ahead and spike your heparinized saline, and you'll want to run it pretty rapidly until the fluid gets up between 50 and 100. And what that does is it wets the filter inside so that the blood inside doesn't clot. Once you get to about 100, you can turn your IV down to about TKO or a little bit faster, and then start to collect the blood. And if you get a really large amount of blood, you can turn up your heparinized saline to kind of balance that. We don't want the blood to clot inside the filter. Okay? You do have a sign on this machine and also on the IV pole that has all these steps. It also has perfusion's phone number. So give them a call, let them know that you're collecting blood, and they can come in and they can process it in the bowl. If you have any questions, call the perfusionist, call me, call Crystal, and let me know if you come up with any other questions. Okay, thanks.